Hi, I'm Dr. Lewis Clark. Today I want to talk to you about why you should do metabolic testing. A lot of you watching this video may not know me at all. Some of you may have known me for years. So therefore I want to introduce myself, tell you a little bit about myself. First of all, I'm board certified doctor of chiropractic here in the state of Texas. I'm also board certified in integrative medicine, as well as a certified chiropractic wellness practitioner. So I'm going to talk to you about why we do what we do in our office, and especially in regards to metabolic testing, or what you may call functional blood analysis. Okay, so if you've been a patient of ours in our office for a lot of years, you may have seen that some things have changed, that we started doing additional things, and I want to talk to you about why that is. We now take a three-pronged approach to all healthcare challenges that our patients face. And what I mean by that, and I'm going to write this out, is we still take a structural approach. Structure meaning your body's spine and nervous system. So structure is still critical because of the way God designed the body. The brain runs everything, and all the spinal cord and the nerves come from the spine. So the alignment and function of your spine is critical to your overall health. But we also now evaluate thoroughly the function of your brain and nervous system. So now we also take a neurologic approach. Now, when chiropractic was discovered over 100 years ago, we didn't have a lot of technology or a lot of understanding about how the brain works. In the last 20 years or so, especially in the last 10 to 12 years, more and more studies have come out about the brain and nervous system and the way it works. So therefore, chiropractic now has developed a functional neurology department or side of chiropractic, which evaluates the brain and the nervous system and the way it's functioning. So in our office now, you'll not only get a complete structural exam, which may involve not only a posture exam, spinal x-rays, palpation of your spine, range of motion studies, but now also a complete functional neurologic exam, which is going to determine if your nerves and your brain are functioning normally. Now, on top of that, there's one other side to your body that is very critical, and that's what we want to focus on today, and it's what's called your metabolic side. Now, metabolic simply means this: your body's ability to take food and convert that to energy. Now, there's a whole lot of steps going on between you taking food into your mouth and you producing energy for your cells, but that in a whole is called metabolic function. So today I want to talk to you about why it's important to have a thorough metabolic evaluation and how you might do that through functional blood chemistry. So before I do that, let me just explain this. In the past, we've gotten great results with structural problems and pain just taking a structural approach. Now, with adding in functional neurology and taking a neurologic approach, we can handle a greater multitude of problems more successfully and more quickly. But I'm going to tell you, even if you do this, you're still not as good and not as successful as you can be, or as healthy as you can get, until you take this third component and put it together. Now, this area right here is what we call the sweet spot. That's where we take your functional neurology, your structural evaluation, and your metabolic function, and we analyze that together and address all three of those problems, is where you get your best chance to achieve optimal health. So if you've never had a metabolic evaluation, let me tell you what that involves. First of all, the first step is to do what's called a metabolic assessment form. A metabolic assessment form is basically a checklist of symptoms and signs and conditions associated with each organ and system in your body. So we'll ask you a group of questions relating to your stomach digestion to see if you have too little acid or too much acid. We'll do another group of questions about your liver function, about your gallbladder function, about your adrenal function, about your thyroid function, about your hormone levels. This will give us an idea of areas that we need to zero in on and begin to address more closely. Now, once we do that, then we're going to want to look at some blood testing. And there's different types of blood testing, but the first step in any functional blood analysis is to get a complete blood chemistry. And I'll say, first of all, this rarely happens today in a medical setting. Why would it not happen in your medical doctor's office? Well, I'll give you two reasons. Number one, the insurance companies don't pay for it. Unfortunately, the insurance companies pay for the bare minimum, and so typically that's what the doctor orders. The second reason is because 99% of the medical doctors have not been trained in functional blood analysis or functional medicine. Therefore, they don't look at as big a picture as they need to tell the function of your body. And besides that, they don't not only run a limited number of tests, but they also look at the wrong numbers. For instance, when you get a blood test back and your medical doctor goes over that with you, you may have heard this before. They may say your labs are normal, but you don't feel normal. Well, why is that? Well, the reason is because they're looking at values called laboratory values. And these are actually averages of every person that goes in a particular lab. Now, I'm going to tell you the truth. As you probably know already, most of those people that go in the lab are not healthy. So therefore, you end up with a very wide range. So therefore, you can actually have symptoms before you actually go out of that range. And so you still have symptoms, although your medical doctor says it's normal. So it's important that we run the complete test and the right test. It's also important that we look at the right numbers. We look at what's called functional blood numbers. That means that they're averages of healthy people, not just averages of everybody that goes in the lab. Now, the other thing that's very important is our functional blood analysis looks at 60 markers. The average looks at about 20. So we're looking at 3 times as many things. The other thing is you can do more advanced blood testing if necessary. Like for instance, if you have signs of an autoimmune condition, you can look at antibodies to see if you have an autoimmune condition show up in your blood. You can also, if you have signs of food sensitivities, you can run food sensitivity tests to see if you have a reaction to gluten or other foods. You can also run leaky gut tests to see if there is a problem with the gut lining that's allowing things to get into the bloodstream that shouldn't be there. And lastly, we can do also hormone testing through saliva. And this includes adrenal profiles to check for adrenal stress and for adrenal fatigue, but also male and female hormones as well. And so by doing this, it gives us a complete picture of what's going on with your metabolic health and metabolic function. And not everyone is going to have the same problems, not everyone's going to get the same test, and not everyone's going to need all of these tests. But they are available and they can be helpful if you have a particular condition that needs to be identified. So I want to leave you with this thought. If you've been a patient of ours for a long time, or if you're considering becoming a patient in our office, certainly consider doing metabolic testing, because I've had patients literally that have been seeing me with chiropractic, getting great results with pain and structural improvements, and they've never had evaluations, and then they find out years later that they had an undiagnosed autoimmune thyroid problem or something else that was going on and getting worse. It's the sooner we catch it, the sooner we can deal with it, and the less damage you have. So, God bless you. I hope this helps you understand why we do what we do and also what needs to be done to thoroughly evaluate your test. Have a great day.